A very good day to all the judges. I'm Dr. John Chong Kek Hong from Faculty of Dentistry, University Science Islam Malaysia. Today, I'm going to present our innovations, which is PosCare apps. These are my team members, Associate Professor Dr. Asma, Associate Professor Dr. Azrul, Dr. Anuddin, Dr. Shatira, and Dr. Zuraira. Surgical extraction of third molar is the most common surgical procedure conducted in dental clinic. Post-operatively, patient will experience immediate or delayed complications. The immediate post-operative complication that happen in the first 3 days could be pain, bleeding, swelling, lymphoma opening, and difficulty in swallowing. So whereas the most common delayed complications can be nerve injury, which can be presented with numbness and tingling sensation. Patient will also present with post-operative infections and inflammation. Therefore, it is very important to provide patient with clear post-op instruction to minimize the complications that affect the patient comfort and the quality of life. So what is post-operative instruction? Post-operative instruction is the instruction given to the patient after surgical procedure. Post-operative instruction can be given in verbal and written form. The verbal post-operative instruction is the most common form being used because of direct and cost effectiveness. However, the information may not be standardized because of operator dependent. Written post-operative instruction make patient much understand because using visual and written. Therefore, it's important to ensure understanding patient satisfaction and compliance, and also to prevent post-operative complication, morbidity, and patient complaint and or allegation. So this is our PosCare app, which is actually an app that compiles series of instructions given by the dentist after conducting a surgical procedure to remove an impacted third molar. Our problem statement is, we understand the shortcoming of the verbal approach because Usin Dental Clinic is still adopting the verbal form of post-operative instruction. We therefore to develop a post-operative instruction module using an app which could be both user-friendly to the patients and cost-effectiveness to the dentist. This is our objective, to develop an online platform that can deliver post-operative instructions to patients after oral surgery procedure. This photo shows the process of developing an innovation app through various meetings, gathering ideas and information among the team members. The idea is collected, compiled, and stored at Excel. We uploaded the Excel Auto the Glide platform to develop the apps. To improve the apps, we utilize plan, do, chat, act strategies. Firstly, we plan and gather the idea for which apps to develop. Once we determine the apps, which in our case is PosCare apps, and we will conduct the pilot study on patients that undergo surgical extraction of wisdom tooth using these apps. After that, we will gather and collect the patient feedbacks and improve the apps. These PosCare apps consist of 9 topics, namely introductions, management of pain, bleeding, swelling, and limited mouth openings, oral hygiene instructions, dietary intakes, things to avoid, and follow-up. These PosCare apps can be installed by clicking on the link provided or scanning on the QR code. These apps can work in any devices, either Android or Apple products. This is the layout of our PosCare app, which consists of 9 topics, namely introductions, management of pain, management of bleeding, management of swelling, management of limited mouth opening, advice on dietary intakes, advice on oral hygiene instructions, precautions and things to avoid, and the last topic is follow-up. In the introduction, the app describes the post-op instructions and its significance, as well as anticipated complications that occur after the surgery. The apps describe the pain is a normal reaction after the treatment and can last for several days. Most of the pain can be relieved by medication prescribed by the dentist. Therefore, it is recommended for the patients to take the medication as per instructed by the dentist. Slight bleeding from the extraction socket is considered normal for the first 4 hours. The app advises the precaution to be taken by the patient to stop any additional bleeding. Facial swelling is a normal reaction and it will usually occur after a few hours after the surgery, and it will normally subside after the 3rd days onwards. Treatment is actually described as difficulty in the mouth opening. It's a common complication after the removal of wisdom tooth, and it will usually disappear with time. Patient would be advised to do light jaw exercise by slowly open the mouth until to the maximum and then rest. Do it a few times in a day. Soft liquid diet is normally been advised after the surgery. Patient can slowly build back to the normal diet after a few days of surgery. Oral hygiene instruction is very important for patients to self-care the extracted socket to prevent further infection. PosCare apps will advise the patient to refrain from smoking or drinking alcohol because this habit can actually delay the wound healing. Follow-up appointment will be usually given to patients to return to dental clinic for further review of the wound healing. We have tested the app with our patients and these are the positive feedback given by them.
Dah. Terus nak cari senang.
Kadang kita dah bagi je, tapi kadang macam balik rumah dah lupa kan. So, memang kan.
Hopefully, these apps could be used among dental fraternity in Malaysia and it beneficiary to both patients and dentists. In very future, we are planning to apply for patent intellectual property and this app is potentially be commercialized to the potential group. For the conclusion, this PosCare app is very beneficial to the patient as it's very cost effective and save a lot of chairside time. Yet, we can provide a standardized post-op instruction to the patients. With that, I thank you for your attention.